shall be speaking today on ACL rehabilitation. When is the right time to return to sports? When can I play again, doctor? This is the emotionally charged, quintessential question asked by nearly every athlete after the ACL injury, and also by parents, teammates, coaches, and even media in case of elite athletes. To meet these expectations, swift surgical intervention and accelerated rehabilitation becomes a priority. A simple answer to this can be probably within 1 to 9 months, depending on the treatment that is best for you. Or on a lighter note, even on the next day of surgery, only if you professionally play one of these sports. And that, friends, should sum up my talk. However, on a serious note, the answer is much more challenging. I personally feel this is one of the most pertinent topics in today's times, when time to return to play is the standard by which orthopedic surgeons measure themselves and are measured in the sporting circles. Sports medicine has made giant advances in ACL treatment programs. We have progressed from extended casting to short-term bracings to arthroscopic ACL reconstructions.
Dr. Abhishek, we can still see the only first slide, that is when can I play.
Sorry, it's not running?
No. So I think you need to click on shifting the slides manually. So we see only when can I play again, doctor. That slide, second slide.
No,
only second. So please take your cursor on the.
Can I control to slide control?
Now we can see the third slide.
You can see the third slide, but is it in the full screen mode or is it like in the PowerPoint?
Not full screen. It's a PowerPoint mode.
Yeah, because as soon as I do it in the full screen mode, I think now is it running the fourth slide?
No.
It's
still third. So let it be in the PowerPoint mode, and you can shift the slide by clicking.
Okay. So should I start the presentation all over again, because it's a...
No, I think you can go back to start from third slide now.
I think you can share one more time. Just share again.
Please open the PowerPoint, then share.
Yeah. So
you can go to the slideshow mode. Try it out.
Okay.
But it's not working.
No, it's not working.
Now, no.
Are you sharing the screen or sharing the PowerPoint when you share your...
You have to share the PowerPoint.
I think you're sharing just the screen.
You can unshare again. Keep the PowerPoint in the desktop. Then share the PowerPoint only. Just go click the share screen. Then see your PowerPoint. Just click the PowerPoint.
Yes. Then share. Yeah.
Now we go to the slideshow.
Yeah. Is it playing any different slides? I'm just.
It is in the fourth slide now.
Yeah. This. Can you see some figures?
No.
Can I give the controls of slides to you, because it is giving an option of slide control to say Dr. Sundarajan. It says, can I give the controls to you?
Yeah, if you want me to move, I can move, no problem. But
Dr. Ashok Shyam.
Give to Ashok Shyam.
Okay.
No, I don't think that will work even if sir controls. So I'm stopping your sharing. Just click on the share screen tab. Let me know what you can see.
So I can see multiple screens. So one
Yes.
of them is the Zoom one, and then the other few is.
What are the others? Is there a PowerPoint scene there?
Yeah, my PowerPoint is seen here.
Just click on that and share.
Yeah, I've clicked on it and shared.
Yes.
That's what I did the last time as well.
Okay. Okay, then go back and click
Can
on the.
Can I give you the controls by means of any of the apps, AnyDesk or something?
No, that will not work. Are you using Zoom browser?
No, I'm using the Zoom app.
App. No? So again, you can share the first thing, share the screen completely, not share the PowerPoint. That should work then. Now go to the share screen, click on the first option, that is share the screen. Now go full screen.
Yes.
Go ahead, sir.
Yeah,
Okay, good.
Yeah.
Yeah, it's working now.
perfect.
Oh,
Start.
good. I don't know what happened,
Huh.
but anyways. So I thank the organizers for this opportunity, and I'm speaking on the ACL rehabilitation. When is the right time to return to sports? So where this question, when can I play again, doctor? This is one of the most emotionally charged and quintessential question that is asked by nearly every athlete after their ACL injuries, and is also asked by their relatives, their teammates, their coaches, and even by the media in case of elite athletes. And to meet these expectations, swift surgical intervention and accelerated rehabilitation becomes more of a priority. A simple answer to this can be probably within 1 to 9 months, depending on the treatment that is best for you. Or, as I said, on a lighter note, even on the next day of surgery, if only you play one of these indoor sports. Uh, but this question is quite challenging and is one of the most pertinent questions because the time to return to play is the standard by which orthopedic surgeons they measure themselves and are measured in the sporting circles all over. The sports medicine has taken giant leaps in the ACL treatment programs, and we have progressed from these uh, extended castings to short-term bracings to arthroscopic reconstruction of the ligament, and also from long hospital stays to the short hospital stays. Back in 1970, Kennedy stated that ACL is the most common cause of an ex-athlete, meaning thereby that the treatment offered at the time did not permit athletes to go back to sports. From there to the more recent claims of swift rehab and quick return by the use of internal braces or the dynamic interligamental stabilization devices. Coming on to the operative versus non-operative group, if we see the operative group, about 65 to 88% of these sportsmen are able to return to the sports within the first year. And in the non-operative groups, about 19 to 82% return rates were observed. The athletes who successfully return to sports after non-operative treatment probably represent a selected group within the functionally stable knees and a strong motivation to continue pivoting sports despite their injury. More recent and influential meta-analysis on this topic by Andron et al. Suggested that 82% ACL reconstructed sportsmen resume sports activity. Of these, 63% return to pre-injury level and 44% return to the competitive sports. Rate of re-injury, the re-injury risk varies from 2.3 to 13%. Michael et al. Suggested that 22% in the non-operative group underwent an additional meniscal surgery as compared with 12% in the operative treated players. The incidence of risk re-injury in the first 2 years following reconstruction is estimated to be 6 times greater than those who didn't suffer ACL injury. About 25% of the athletes who undergo a second revision within 6 years of the primary ACL revision. Let's now discuss the re-injury risk factors. So there are various biomechanical factors such as abnormal loading distribution pattern, increased knee external rotation, abduction movements, side-to-side differences in the extremities, frontal plane trunk displacements have all been associated with the ACL injury. Besides this, the deficit in the quadriceps strength at 1 year follow-up, a difference of thigh circumference of more than 1 inch, neuromuscular control deficits, Also, re-injury risk is associated with early return to sports in less than 9.5 months in surgery. So how to prevent it? The side-to-side quadriceps symmetry is essential. Also, the hamstring to quadriceps strength ratio should be at least 85% before returning to sports. The research indicates that for every 10% reduction in this ratio, there is a 10% increase of ACL graft rupture. Also, the sportsman should be subjected to single leg plyometric test before returning to sports. Significant reduction by 51% for each month return to sports delay until 9 months after surgery, after which no further reduction was observed, meaning thereby that at least for the first 9 months, one should avoid aggressive sports participation. Young athletes, it is typically suggested that this be delayed for 2 years after reconstruction, because this is the time when the process of ligamentation is going on. A systemic review by Barber-Westin et al. Laid down the return to sports criteria, and they suggested that in order to give clearance to return to sports, an athlete must have less than 10% deficit in strength of quadriceps and hamstrings, less than 15% deficit in lower limb symmetry, less than 3 mm of increased AP tibial displacement, greater than 60% normal knee separation, distance, absence of effusion, full range of motion, normal patellar mobility with only slight patellar crepitus, painless activities without swelling, and self-motivation. The International Knee Documentation Committee, or the IKDC Subjective Knee Evaluation Form, is a good tool to assess knee function and differentiate the high knee function from low knee function. This Stark framework chart can also be used to make decision for return to play. Another important study, narrative view of current evidence by Zafagnini, they lay down the guidelines on the basis of various intrinsic and extrinsic factors, and that is also of quite a use when making a decision on return to sports. Mayer et al. Suggested these stages of rehabilitation, and that any athlete should be subjected to these stages before advancing to the real sports. As of the recent development, quantification of the pivot shift test with, for example, accelerometers or image-based softwares, tablets and iPads to measure the acceleration or tibial translation during the pivot shift maneuver are needed. And future studies need to be focused on motion analysis of specific athletic movements and actions. Now we come to one of the most important aspects of this topic, the prevalence of osteoarthritis. There is an inherent risk of developing radiological signs of OA with time after an ACL injury. So after 10 years, approximately half of the patient displays signs of osteoarthritis. An extrapolation of these results suggests that nearly all patients have OA after 15 to 20 years, and all athletes undergoing a revision ACL had OA when they were re-examined about 3 years from the reoperation. Studies also suggest that there is a significant risk of re-injury to the graft as well as menisci, cartilage with continued sports participation. And eventually, nearly all patients will develop osteoarthritis with time. We all want our patients to do well, and such results are definitely encouraging. But instead of focusing so much on when to return to sports, I suggest we take a moment to talk about the more difficult question I'm going to give you. Should you return to sports? Is it the time to quit? Is it safe to return patients to pivoting sports? Doctors should caution whether return to high-level pivoting sports is in the athlete's best interest after ACL injury, if long-term knee health is the primary concern. So to conclude, the available evidence is inconsistent. No standard criteria should be applied to each patient. It would be preferable to apply patient-tailored rehab programs and return to sports criteria. And future efforts should be directed at improving the objective evaluation of the patient and lay down the criteria where we should measure treatment outcomes than the time to return to sports. I end my presentation with thanks to you all for the patient listening and all these athletes who, in spite of having ACL injuries, brought laurels to our country. Thank you.